Good morning, good afternoon and good evening wherever you are around the world, and welcome to the members meeting of IPDLN 2020. So I'm Merran Smith, I'm the current director of the IPDLN, and I'm based in Perth at the University of Western Australia on the banks of the sunny Swan River. And I have with me Dr Emma Gordan and Professor Chris Dibben from ADR UK, who are the incoming IPDLN co-directors and who'll be taking over from me on the 1st of January 2021. So today we've got a short agenda. I'm going to just run through a report in terms of what's happened in IPDLN for the last 2 years. Then I'll hand over to Emma and Chris to say something about their plans for the coming 2 years. And then we'll have some time for any other business if anybody wants to raise anything. And I guess by now, I hope by now that most of you are familiar with the platform. So if you've got a question, you can just type that into the questions and answers, and there'll be a chance to ask me questions. So I'll respond after my report. The same for Emma and Chris. And then when we've got other business, that will also be via Q&A. So I'm not sure if everybody that's attending this meeting are members of the IPDLN. Welcome if you are, and if you're not, that's fine as well. And perhaps you'd like to consider joining. So I'm now going to share my screen. Can I just check, Emma and Chris, that you can see that now?
Not at the moment.
Can you see that? Is that now?
Yes, that's good.
Okay. Just a page down. So that's just summary of the agenda for the meeting. And I'll now move to my report. So I'll start with a quotation from that famous Scottish poet, Robert Burns, who said, "The best laid plans of mice and men often go awry." And that was certainly the case for 2020. I don't think anybody that were recovered from their New Year's Eve party on New Year's Day ever thought that 2020 would turn out the way it has. But as we know, COVID-19 appeared on the world scene and we had a global pandemic, and that certainly impacted everybody's plans, including ours. But we did manage to get most things that we had planned done, and we actually managed to do a few other things besides. So in terms of governance for the network, the IPDLN Executive Committee met on a regular basis. There were numerous Zoom meetings and a lot of emails. And some of the things we did in the governance area were developed and endorsed the terms of reference for the Executive Committee. And we also developed a role statement for the director, which we found when we actually came to advertise or call for nominations that we didn't actually have one. So that was also quite useful. In terms of IPDLN relations, in the middle of the year, we signed an MOU with the International Journal of Population Data Science, and that really cemented the relationship, the strong relationship that already existed between the two groups. And it does include reciprocal representation. So the director of IPDLN is on the editorial board of the journal, and the editor of the journal is represented on the IPDLN Executive Committee. And that relationship has helped with things like getting abstracts from the IPDLN 2020 conference actually published in a volume of the IJPDS. We've also had a connection with the OECD, and I was invited in November last year to give a presentation to the working group on healthcare quality and outcomes, because they were quite interested in how linked data could help them with some of the indicators they want to prepare. And also gave a second presentation to a technical group on integrated care in August. So I think that's quite a good relationship for IPDLN, and I'm hopeful that that will continue with the incoming directors. So the IPDLN membership, we've got over 1,100 members from 56 countries, and that doesn't include new members that have signed up as part of the conference registration process, and will process those requests after we've managed to get the conference over and done with. So there'll be some additional members there. So welcome to all the new members. Mostly, perhaps not surprisingly, the members are from North America, UK and Australasia. And there are also some new members from South Africa, which is really nice. But we still have gaps in Northern Europe. And I know that's something that the incoming directors are interested in attending to. And also in Asia. I do recall 2 years ago that we were hoping to get more members from Asia. And we have worked through some personal networks that we have, but that hasn't really translated to many additional members. So that still remains an area that we want to pursue. And mostly our members are from universities, research institutes and the government sector, although there are some members from the private sector. In terms of communications, that was something we thought was also important. And our Executive Officer, Charmaine Lobo, has been very active in that regard. We've done some improvements to the website in terms of its look and functionality. And over the period from January to November this year, we've had almost 6,800 users and over 14,000 page views. And quite interestingly, for those that know about website metrics, people are actually staying on the pages, so they'll be spending up to 2.5 minutes per page, which is quite good, I think. So obviously they're finding valuable content. We've also sent out regular emails and we've promoted conferences and training events. And we've had active social media with almost 1,400 followers on Twitter. We also did a member survey. We sent that out in May 2020 and we had over 133 responses, and thanks to all those respondents. We covered 3 key areas around communications, and we asked members how they would like to receive communications from us. And they did prefer, their preference was for newsletters and web blasts, and we've certainly been doing more web work this year. They're also interested in collaborations, perhaps through common interest groups around areas like cancer or maternal and child health. And there was also an interest in regional activities because, of course, IPDL runs a conference every second year, but there's not very much in between. So we have contemplated the possibility of regional activities. And it may be that in the year between the conference, there could be some things happening at a regional level. And there seem to be critical masses of people in the UK, Europe, North America and Australasia zones. And we did ask people if they were interested to please provide their email contacts. And for various reasons, we haven't had a chance to follow up, but I think it is still something that's worth pursuing. And some of you will have seen the summaries of that member survey, which we've circulated to members. And then the conference. What can I say about the conference? I can say that we were all happy to welcome you to Adelaide, and the Adelaide Convention Centre was booked, and we had a fabulous conference dinner planned at the National Wine Centre, which is just up from the Convention Centre. That wasn't to be, but so we had to turn around very quickly and translate what was to be a more traditional conference into a virtual conference. And I hope that's working for you. It's certainly been a steep learning curve for us and for the presenters. So some of the abstract presenters had to pre-record their presentations and provide that. And then, of course, the facilitation has also been very different. So thanks to everybody that's embraced that learning and been able to transition to the conference that we're in the middle of having. I think there was really good registrations for our workshops. We had over 350 registrants that we were really, really pleased about, because we just didn't know how to price these and whether there would be the interest, and we're really pleased that there was. In fact, there was such good interest that we were able to offer student scholarships that we hadn't originally thought we'd been able to. So we were very pleased to offer 5 scholarships to the workshops, and congratulations to those people who were actually successful. And we've also had strong conference registrations, over 615. Most of those at the early bird rate, but there was still interest to register at the full rate. And I think that's been terrific as well. So I think there are lessons for us for future IPDLN virtual events. And certainly once we've managed to get to the end of the conference, we'll take some time to write up our experience so it's available to the incoming directors and any other groups that are interested in embracing this opportunity. And probably last but not least about the conference, I should just remind people that conference feedback is really important. I know a lot of you have been providing feedback on the individual sessions, but we'll also have a separate questionnaire at the end of the conference asking for a little bit more detail of what you thought worked well and what you thought might be done better, and that'll be enormously valuable for us. So stepping back and just reflecting on the last 2 years and what's happened over those years, look, I think there's been some wonderful research, and this has really been captured in the IJPDS and other journals. So the community around the world using linked data to support population research is strong and very active. And I think there's also been great progress in the supporting data linkage and access systems. And we've already in the conference heard some new developments. So, for example, in Population Data BC with a new platform that their ministry is setting up. And I think that's very powerful. So over the 2 years, things have continued to evolve. And I think that's really good. And the other thing that I think has demonstrated the maturity of the international data linkage community has been in response to COVID-19. And many, many groups around the world have been an integral component of their country and their jurisdiction's response to COVID-19. And I think that response has been the better for the linked data resources that now exist around the world. And probably last but not least, I think there are new opportunities. So through the conference, we've heard about things like AI and machine learning. And I think 2 years ago, that was hardly on the horizon. So I think that's moved forward in leaps and bounds. And so I think that's perhaps just an example of the opportunities. And I think there probably still are opportunities in the COVID-19 area. Certainly in Australia, we've found that our notifiable diseases, which used to be linked on an annual basis in most jurisdictions, are now being linked in a near real-time basis. So I think that's another opportunity. Perhaps I'll finish with some thanks, particularly to the PHRN board, so Population Health Research Network Board, and PHRN's the Australian National Research Infrastructure Network for Linked Data, who provided funding support for our executive officer, who's enabled us to have an executive officer who worked on a part-time basis for the last 2 years. That's Charmaine Lobo, who many of you will have already met. So thanks to Charmaine. And a particular thanks to our outgoing executive committee, to Michael Schull and Bill Garley, who were the previous directors, Karina Jones as the IJPDS director, and to Ruth Gilbert, Raina Schnell, Dennis Culhane and Rachel Moran. And then from the conference to our organising committee, to the scientific committee, particularly David Preen and his group, that thought they had the situation all under control with their online conference and then had to suddenly shift to reconceptualising the program in a virtual format. To our IPDLN sponsors, and last but not least to the PHRN Program Office staff, who's been absolutely fabulous and who have just been working flat out day and night to make the conference happen. And then a warm welcome to Emma and to Chris, our incoming directors, and to the incoming IPDLN Executive Committee for 2021-2022. I'm very pleased to announce that that committee is the new co-directors, Emma and Chris, myself as the past director, Karina as the editor of the journal, and Ruth Gilbert, Kim McGrail, Raina Schnell, Dennis Culhane, and Rachel Moran. Welcome to you, and I think the IPDLN is in very good hands for the next 2 years. So to finish, any comments or questions? So I'm just seeing if I can get through to the questions, and perhaps Chris or Emma, you can give me a bit of a hand in highlighting some of the questions.
Yes, Michael asks, any preliminary reflections or recommendations for new exec on the virtual format for the 2022 conference? I guess this might be, I assume, Michael, if we have to hold it as a virtual format, or...
Sorry, could you just say that again, Chris?
Yes, so Michael, sorry, am I not clear?
Just summarise the question again.
Yeah, so Michael was asking any preliminary reflections or recommendations for the new exec on virtual format for the 2022 conference.
Well, probably it's around setting a varied program. I think with this program, we've had some keynote addresses, we've had some symposium sessions, and then we've had some presentations, sort of shorter presentations, and then some synthesised discussion. So I think variety is good, and I think short's probably good. So some of these sessions are sort of running for maybe 2.5 hours, and I think probably not running much longer. And I think the other challenge was around the time zones. We're a little bit worried that people may not have been able to adjust to the variation in time zones, and pretty well without exception, people have done a fabulous job in doing that, and most people have been able to turn up on time, including the speakers and the chairs. So that's been very reassuring too. So we've run it over a week. We thought it was a bit too much to try and squeeze all that into 2 or 3 days. So perhaps that's another lesson to over a week with sort of morning, afternoon and evening sessions. I think that's probably worked quite well too.
So a follow-up here from Lisa Sharwood. She actually requests that it's not a virtual conference next time in 2022. So there'll be some interesting discussions, I guess, the exact format.
Yes, and that will really depend, I suppose, on whether those immunisations, vaccinations actually come to fruition, whether there is travel. Certainly at the moment, there's hard borders around Australia. We're finally just we're able to, for many months, we weren't even able to move between states. So whether or not, what the world would look like in 2 years' time, hard to predict. Hopefully, COVID-19 will be a distant memory, but who can say?
There's a question simply on what's the term for the incoming executive committee?
It's just 2 years, so a 2-year term from 1 January 2021 to 31 December 2022. And
we got a question on the nature of people's submissions, I guess. So at the moment, it's a submission by abstracts and published abstracts. So the question is, has there been any thought about whether short papers should be requested, or I imagine maybe published afterwards?
We did, when we called for abstracts, we did ask for a variety of submissions. So there were sort of symposium sessions, and we've got some of those. And there were then just sort of more regular scientific abstracts. And I think we also asked for sort of different types, like sort of something new or different. I think we got a couple of submissions, but in the end, they didn't go ahead. So some variety might be a good thing, but I think probably best to leave that to the incoming conference committee.
We'll consider it. Yes, so there's another technical question about, so the new incoming, I think this is somebody who probably hasn't been involved in the network for very long, asked about what were they voted in? Was there a voting process? How does that actually take place?
So the process for the directors, we called for nominations for the directors, and we actually didn't get any nominations, and ADR UK put in, perhaps let's say at request, we're interested in putting a submission, and that was accepted, and congratulations and thank you very much. And we also called for nominations. We put through a slate of nominations for the executive committee, and we we had one nomination and from someone that wasn't judged eligible. So we went ahead with that slate of nominations, and that was the process for the incoming members.
Yeah. So I should say that there's quite a few congratulations on a really well run conference. There seems to be quite a lot of support for the workshops that have seen particularly have been appreciated. So perhaps that's certainly a message for the next committee to take on board, that they're particularly welcomed. I think there have been more workshops, have there, than we've done before in conferences?
At other conferences, there have been workshops. In a way, I think by having a week of workshops, it allowed, we had 7 in the end, and that's probably a little bit around about the sorts of numbers they've had in the past. But because we could spread them over, sometimes with a face-to-face, they've often been sort of the day before the workshop, and so you might have had sort of 3 in the morning and 3 in the afternoon, and you had to choose, whereas this way we could spread them over a week and then people could go to more than one, and a number of people actually did go to several.
Yeah. So that seems to be all the questions at the moment.
Okay, well, look, thanks, Chris. Thanks for doing that, because I'm just struggling to see the questions as well as to see the faces. So then if we can hand over to you and Emma to actually give your presentation, your plans for 2021-2022.
Yeah, thanks very much, Merran. And I'm just going to share my screen, and I'll run through the presentation, and then obviously Chris is here to answer any questions as well. So yeah, vision for 2021-22. So first of all, I'll explain what the ADR UK programme is very briefly, and where Chris and I are coming from around this. So ADR UK is a programme that's based within the UK, but right across all of the constituent countries of the UK. And it's designed to work with UK government departments and devolved administrations to unlock the potential of administrative data to support policy-focused research. And it was designed like that, very much to as a collaboration between academic researchers and government data owners, to really sort of bridge that gap and get the benefits of both parties being involved. And we really want to be the default choice to host linked data across the entirety of the UK in devolved government, making that accessible to external researchers, sort of free at the point of access, really. And yeah, it goes without saying that Chris and I are really excited about taking over the directorship. And if I explain just briefly where we come from on this, I started off my career as an academic researcher analysing linked health and longitudinal survey data. And then I moved into the civil service doing various roles, one of which was to be the head of health analysis at the Office for National Statistics. So in that role, I was the person on the other side, sort of negotiating access to data on behalf of academics and sorting out data access agreements. So I've seen it from both sides of the fence, if you like. And I now work at the Economic and Social Research Council, leading this ADR UK programme. And many of you will already know Chris Dibben from Edinburgh University, as he's been an active member of the health data linkage community internationally for many years. And he also works really closely with me because he's co-director of ADR Scotland. Just going to my next slide. So I'm not expecting you to read all of the detail on this slide, but it's just to sort of give you a feel of the scope of the ADR UK programme, and just to really highlight that it is a partnership right across the UK between government and academic units, sort of bringing them together. And we've also got the Office for National Statistics sort of as our major data infrastructure partner in collaboration with those in devolved administrations. I also wanted to point out that even though Chris and I both come from a background of health data linkage research, that we're very much sort of agnostic in terms of the topics that we want to promote around data linkage. And indeed, we've got involved in a lot of different sort of topics of data linkage. And we see this is actually really important, because if you think about something like the pandemic response to COVID, that in its early stages has been very much focused on getting access to good health data and finding out, most importantly, who has got the been diagnosed with COVID. But moving forward, we know it's going to be really, really important that that data gets linked to other data, such as educational attainment data, benefits data, income data, for example. And within ADR UK, we've also done a lot within the UK to open up access to administrative data held on the courts and justice systems. So we'd be really interested in kind of expanding the IPDLN network and membership across a whole new range of areas as well. I'll go on to the next slide. So yeah, we want to engage with the existing membership, obviously, and you know, we've seen the results of the survey that Merran and her team ran in May this year. And we really want to build on that to kind of canvass where these sort of research priority areas are for 2021-22. And we'll be running another survey that might be later this year or maybe early next year. So there's kind of a year between the surveys. And we're really interested in establishing sort of virtual common interest groups and regional conferences and workshops. And I don't know about sort of people listening, their experience of attending virtual conferences. And, you know, obviously it's harder to get the kind of networking in that you get at a face-to-face conference, but there's no doubt that there's benefits in running virtual activities, maybe in between sort of the 2 yearly international conferences, because it is a really good and cost-effective way of reaching out to people right across the globe and linking them up and sharing good practice and everything. So we also really want to strengthen the network, and because we're a partnership within the UK that has membership from government partners as well as academic partners, we see this as a real strength, because we've obviously got access to the networks for both of those communities. And so we really want to kind of strengthen our links to the government network, international networks such as Eurostat and OECD and UNECE, and sort of reach out across those to help sort of strengthen the network. And we've all our experience of running ADR UK has meant that we've got a lot of experience in sort of using social media to promote what we do. So our program started a couple of years ago, 2.5 years ago now, and we've now got a Twitter following of over 4,000 members. So we really see this as kind of part of the future, and we really want to be able to do the same for IPDLN network. And we've also obviously got really close relationships already with IJPDS, because they're actually based within Swansea, within the United Kingdom. And Karina Jones is part of ADR Wales as well, so already part of our partnership. So we'll definitely be strengthening that relationship in the way that Merran suggested in her talk as well. And obviously we'll be taking over the IPDLN governance arrangements, and we look forward to that. And as we've been discussing in the Q&A for Merran's talk, running the 2022 IPDLN Conference. And we are planning for that to be a face-to-face event, if at all possible, in around September 2022. and potentially that would be based in Edinburgh, where Chris is based. I'm based in a very rural part of Wales, so it definitely won't be near where I live. Yeah, would obviously be supporting full range of cultural activities, and really looking forward to inviting people to the UK for that. And yeah, that's the end of my talk. So if you want to go to the Q&A, I'll stop sharing my screen now.
Excellent, Emma. Well, look, thanks very much. That's a really lovely overview of what your plans are. And I've got, there are a couple of questions here. One question is, does ADR UK work alongside NHS Digital?
Yes, we do. And so there's a kind of web of networks across the UK, and Chris is actually formally part of both. So there's Health Data Research UK and Admin Data Research UK, and Chris is formally part of HDI UK, as is NHS Digital, but we collaborate with NHS Digital as well, and we're actually funding them to do some data linkage in collaboration with some an academic group as well, linking hospital episode data to educational attainment data. So yes, they're very much, you know, part of what we're doing as well.
Excellent, thanks. And there was one other question, this is from Simon. Simon Thompson. I welcome ADR taking the lead, a very capable group of people. Participation by European countries has always been lower than it should be within IPDLN. What can be done to address this?
Chris, do you want to lead on that one? I'll come in.
Yeah, sure. So I think first of all to say we welcome feedback on that. I think Emma and I have discussed this, and I guess there's at least a dual-pronged approach. One will be to engage with some of the major official statistical agencies across Europe, like Eurostat, because of course in Europe, administrative data, both in the health and the more socioeconomics, is a more fundamental part of official statistics. So we need to discuss and see where there might be benefits to both sides of further engagement. I guess the problem I've always sensed is that because it is so routine, in particularly Scandinavian countries, that they've probably felt there's less need for a specialist group like our own, which focuses on a lot of the knotty problems we all face, like governance and public perceptions, given that it's far more established process. But there are countries that are tackling, problems more similar to the ones that I think we're used to, and I think certainly there'll be engagement there. So I guess the second one is just to use the networks we have got to discuss and see how there might be synergies and how we might start, collaborating, maybe jointly engaging, but then perhaps through the conference, looking to organise sessions that might particularly, work across those communities to initially, I guess, to try and get them to engage with the conference, but then wider into the any kind of specialist groups that might be emerging over the period. Have you got anything to add, Emma?
No, that pretty much sums up, what I think will be our approach. And yeah, as somebody who's attended Eurostat meetings and academic conferences, I genuinely think that will be a really effective way to reach out. And OECD as well, that they run really good events on data linkage occasionally. We will be sort of reaching out to those networks as well, because that's a good way of linking up with both government and academic partners as well.
Okay, thanks. There's a couple of other questions that have just come in. Another from Michael Shaw. Any thoughts around how IPDLN can help forge international collaborations across data linkage networks?
I assume, Michael, are you actually thinking about actually sort of joint working projects that try to produce some kind of informational data resources across countries, and therefore is that the kind of collaboration you're talking about? So you can't react very quickly with this meeting. I mean, certainly just to follow up on that, I realised since the inception, I remember the very early discussions about the network, there was possibly a hope to do an international collaboration in terms of, you know, a particular research question. And I've always thought that would be really good, but, you know, quite difficult to organise. But, you know, perhaps around something like COVID-19, you know, there might be an opportunity, although, of course, things are moving very quickly, so that would have to be something we'd engage with quickly. Yeah, so that is what Michael was talking about. Yes. I mean, that certainly is a very good way of cementing relationships, isn't it, if we're actually collaborating it. So COVID-19 is an obvious one, but if other people could think of other important ones, I guess the challenge has always been, as with all these things, of the need to harmonise across different data structures, and sometimes that's hard enough across states and provinces within a country. But I think we're always hoping that out of that international collaboration, there might be some interesting work on harmonisations. And certainly there's a lot of development on fleet-footed ways of networking metadata that doesn't require full harmonisation, but can work cleverly. So I think there's an absolute area ripe for work. I guess it would take quite a lot of involvement from people. So we've probably hoped that there's a commitment of time from people to that kind of idea. But certainly something I think, Emma, we'd welcome exploring. And perhaps something that ADR UK with some resources might be able to support.
Yeah, very, very happy to look into that. And within the UK, we're also doing some work to sort of improve sort of even basic things like sharing catalogue information on where data is held, and you know how people can view the metadata and things. So much more basic things than Michael's talking about. But yeah, we've definitely got aspirations in that area. And I noticed another question around what about themes such as public and patient engagement and governance, and what are we doing on that to sort of strengthen that? And I have to say that that is a really, really important thing for ADR UK, and both the other kind of sister network within the UK, HDR UK, and within ADR UK, we sort of embed public engagement into every single program that we fund, because we see it as absolutely essential, you know, for us all maintaining the social contract to do this type of work. But Chris, is there anything else you want to say on that?
Well, just I guess the question is slightly hinting to the challenge we posed, which is, would people be interested in special interest groups that operated away from the conference over the time? And I think, as Emma said, the success of this virtual format has shown that actually we can do this internationally. So I guess we probably look particularly, you know, at feedback. If people are keen to do that, then I think that's something we can look to try and organise. But I understand from Merran that these groups have existed slightly in the past, but they've kind of fizzled out. And obviously around the conference, that's a great time for networking, bringing together. So I think we'd want to be confident there was sufficient demand to do that. But certainly, I think we'd be happy to look in organising that. I guess the question is, do we organise regionally, so people work in the same area but in a region, or we do it thematically? I guess both of those are options.
Okay, thanks. And there's just one matter there that Rachel Moran's reminded me of. So Rachel's been affiliated with the network for quite some time, and she, just in relation to international collaborations, that quite early on there was one study on prostate cancer, and that got together. Was there also one, there may also have been one on vasectomy, but I can't quite recall the details. So I think what the message there is that if it's international collaboration on research, it is possible, but it's also quite challenging. There's another question just come in around awareness of the call for epidemiologists and health service researchers to undertake data science functions using linked data. However, there's a generational divide for EPIs who trained before the advent of more than 2 or 3 stat languages. I wonder whether IPDLN see their role as bridging that gap. An excellent question.
Yeah, I mean, that's an excellent question. Yeah, I think something to think about. I mean, certainly within the ADR UK, it's something we're discussing locally, the need for data science training, and the fact there's quite a lot of support for producing that. So we'll certainly be within the ADR UK, I'm sure, Emma, sorry, I'm sort of talking to you, but we'll certainly be looking to produce materials that uprate people's data science skills, given that people operating these traditional fields are now required. So perhaps certainly we could do a collection of those kind of resources that are available internationally and provide that information so people could access those resources. I guess we won't have the resources ourselves as a network to produce that, but certainly we could help.
Yeah, I completely agree with that, Chris. And I'd just also add that there's an acknowledgement within ADR UK that as we open up new areas for quantitative research within the UK, such as crime and justice, where the data's just not existed before, we need to provide training to people in how to use those new data assets, you know, whether it's traditional stats training or, you know, data science training, because otherwise those new data assets won't get used and will have essentially not really have fulfilled our mission. So, you know, in this new kind of virtual world, it absolutely makes sense that where possible, we can provide that training online so that as many people can join as possible, but also, you know, complementing that with face-to-face training opportunities where possible as well.
Okay, well and that's, somebody's just said, sounds fabulous. So I think you're on the right track. Okay, well, perhaps we'll move on to other business now. There was one matter that was raised with me, and in fact, David Preem sent me an email earlier in the week that was around special interest groups. And he did say that at the Indigenous pre-conference workshop, there was an idea of establishing an international group or consortium for Indigenous linked data because there were common issues being faced by people in different countries. And there was a suggestion that this might be something that the IPDLN might be interested in partnering. And I don't know if there's anybody at this current meeting who is involved in that or wants to post anything using the Q&A about that matter.
Lisa said she was. Sorry. Lisa Sharwood.
So Lisa, I'm just not sure if there's anything that we can really do today besides saying that there could be an opportunity, and certainly our survey suggested that there was interest in forming special interest groups. I am conscious that these have occurred in the past. There's been sort of sometimes when IPDLN has had special interest groups, but they haven't persisted. And it may be that it's something that the incoming executive can look at, and perhaps it would need some proposal and some view about whether it was just a short-term focus or it might have a longer-term focus and how it might be supported and resourced. So I think, well, I can't speak for the incoming directors. It's probably something that IPDLN can consider, and we just have to work through some of the detail. And I can see there's a few comments coming in about that. So Simon said, based on experience, that especially interest groups fall over if they're not owned by someone or an organisation to keep the momentum, and there might be a role for IPDLN there. From Lisa, at the workshop on intergenerational record linkage for family history studies, there was also interest in forming a special interest group. And there was, from Lisa Sharwood, keen interest among the group at the Indigenous workshop to improve Indigenous identification across linked data sets. So it sounds like there are some models or opportunities, sorry, and Lisa, I think you've got a comment there about common data models. no answer about how to identify Indigenous status using common data models. So I think the sort of takeaway message there is that there is some interest, and that it's probably worthwhile working through what the issues and options are. Taking note, I think, of Simon's comment that they do need to be owned by somebody, and these things do need effort and support. And Michael, you've just posted something as well, offering opportunities at IPDLN conferences for a workshop or special presentation for special interest groups could be an incentive, and I think that's a good comment as well. And then Lisa saying that there needs to be an identified leader in the structure to carry special interest groups forward. So I have to say that I did actually spend a little bit of spare time this afternoon during the first draft of a proposal of what, just a sort of a simple one-page format of the sorts of things that somebody proposing a special interest group might want to keep in mind. And I'll take that to the next meeting, the next IPDLN Executive Committee meeting for consideration, and perhaps depending on where that goes, the incoming directors can take it on from there.
Yeah, that sounds really good, definitely.
Excellent. Okay, well, I'm conscious that the clock's ticking, and for some of you it's getting very late, and probably for some of you it's the sun's rising. So is there any other business? Okay, doesn't look like there is. So thanks everyone for attending. Thanks to Chris and Emma for your presentation. I think that really gives us a flavour of things to come, and the tantalising possibility of perhaps getting together face to face in the UK in 2 years' time. Terrific. Okay, thanks everyone. We look forward to catching up at some of the sessions tomorrow.
Thank you.
Bye.